and welcome in general to those who haven't been here to dinner with the docs. I'm Dr. Thad Fever, one of the chiropractors here. Well, everybody knows what I am. So, yeah. Except for everybody watching via video. Alright. Just with our dinner with the docs, our goal is just to educate you guys. Just more on what we're learning, more on what we're finding is important in health and healthcare, and just the stuff that we're studying and that we think is great information for you guys to know. So, I mean, Dr. Hassel always says, and we like to say, just take it as another opinion of somebody that is studying, and this is good information. You know, so do your own research as well. Don't just take everything that I'm saying and say, that's golden right there, because I'm still learning too. So anytime our opinion changes, don't get mad at us. It just means that we're learning more stuff. So today, we're going to talk about a vitamin. Vitamin you have heard of a lot lately in the news and a lot lately in general. Vitamin D. So the most important thing to clear up about vitamin D is the fact that it is not a vitamin at all. Vitamin D is a fat-soluble corticosteroid, also a prohormone. Vitamin D is synthesized in the body as vitamin D3, and we call it a vitamin because it is an organic compound that required as a vital nutrient by a human, by an organism, by us. Because it is a prohormone, it will influence the entire body. Receptor sites that respond to vitamin D have been found in almost every tissue and type of human cell. So I'll repeat that again as we kind of get more talking about how vitamin D works. So vitamin D we get mainly from the sun. About 90% of our vitamin D is from sun exposure. Okay? As a UV light penetrates the skin, it converts the sterol, a cholesterol in the body, into a prohormone. I gotta read this because it's a long word. Prohormone 7-dehydrocholesterol into pre-vitamin D. So the D is carried to the liver and the blood, where it is converted into calcidiol, and then it is converted into calcitriol in either the kidneys or the immune system. Okay? So calcitriol is released into the blood, and calcitriol is the biologically active form of vitamin D. So that's released into the blood where it is basically tag teamed with receptor sites and circulated to all the vital organs of the body that can use it. Okay? The important thing about vitamin D is it influences, like I said before, the entire body as a prohormone. A prohormone. That's a tough word to spit out. Scientists have identified nearly 3,000 genes in the body that have or can be upregulated by vitamin D3. By vitamin D. We'll just say vitamin D. So the receptors that respond to D have been found in almost every type of human cell, from the brain to the bones to everything in between. Calcitriol, the active form of D, binds to the vitamin D receptor site, which can then affect and modulate gene expression. So it gets into the cells and just can affect how that gene expresses itself. You know, whether it's going to express itself towards disease or whether it's going to express itself towards health. So that's one of the reasons why vitamin D is so vital and important in the body. It maintains the calcium balance in the body. That's what we hear most about. Vitamin D is important for what? Maintaining bone density and not getting rickets. You know, that's the biggest thing, but there's so many other things right there. But it maintains the calcium balance in the body by promoting calcium absorption in the blood and absorption through the intestines, and what we eat and what we get and just in our diet. And bone formation also influences the parathyroid hormone to maintain calcium levels within the body as well. So basically, your cells have a DNA library within every single cell that tells how the cell is going to work. And vitamin D is basically, you know, the master key to get into that library and unlock it and figure out how things work. Okay? So we can talk for hours on vitamin D. Just the benefits. I mean, if you were to Google and look up vitamin D, just with all the stuff that's been in the news lately about vitamin D, you could research for days, which is what I did. But basically now, we're just going to cover, I mean, just some of the highlights of the stuff that I found. You know, and it might take, vitamin D, it's one of those things that as you read and research about it, it's so complex that it's simple. Or so simple that however you want to phrase that, it all kind of works the same throughout the body, and that's why it affects so many different things. Like we were saying, that it just has regulation for almost 3,000 different genes within the body, and that's why it can be so beneficial to the body, but it does it by just all the same simple stuff. You know, so we'll cover some of the key points. You know, so it could take me 20 minutes, it could take me a half hour. So if we're done early, let's go outside and get some. All right? So here's a goofy little video I found on YouTube, because videos are fun.
Doctor, I'm concerned about my vitamin D.
Are you having problems with your bones?
Not that I know of.
I can refer you for a bone scan.
No, thank you. It is only that I read that vitamin D is also good for other things besides bones, like depression and...
If you are depressed, I will write you a prescription for Prozac.
No, I'm not depressed, but I do care about my health.
Certainly you should have a prescription for Prozac because of your anxiety about vitamin D.
I wouldn't say I'm anxious. I just want to be healthy. I read that vitamin D is also good for mood and colds and the flu.
My nurse will give you a vaccine for the flu.
But a recent Japanese study found that vitamin D works better than the vaccine.
Only crackpots don't believe in vaccinations.
I'm not against vaccinations. I'm just saying vitamin D is good for more than bones. For instance, it helps with inflammation and thyroid and...
I will write you a prescription for thyroid.
It's not good, but I read that most people don't get enough sunshine, so their vitamin D is low and that causes health problems.
Stay out of the sun.
But isn't the sun necessary for vitamin D?
Doctors do not recommend sunshine. It is a folk remedy.
Well, actually Hippocrates, the father of medicine, recommended sunshine, as did Indian and Chinese doctors for centuries.
That is not science. It's folk medicine nonsense.
They didn't understand about
It's a long
vitamin D,
video, so we won't
but
go
they
through
could
it.
make scientific observations.
But that's basically what it's
Included
boiling
the
down
sun.
to. There's just a lot of stuff about vitamin D, and there's also a lot of stuff that medically we could take that vitamin D will take care of for us. There we go. We'll just say it that way. A lot of benefits to vitamin D. We can start with infections, not just wound infections, but infections that our body has. You know, like cold, flu, virus, anything like that. Vitamin D is a potent antibiotic when it's in the body. It increases antimicrobial peptides and increases the body's anti-inflammatory cytokines, however you want to call it. Yale School of Medicine found that people with high levels of vitamin D got sick half as often as people with lower levels. And also they have faster recovery times, I think by nearly half. So it's helpful in acute infections such as upper respiratory infections, cough, colds, flu, but also just based on that Yale School of Medicine research, that you're less likely to get those things if your vitamin D levels are at optimum. We'll talk about that in a little bit. Vitamin D is good for the immune system because it causes T cells, your attack immune system cells, to change shape and migrate to the uppermost layer of the skin, which is also, ironically, why vitamin D is good against skin cancer. Ironic because they tell us to stay out of the sun, but where do we get vitamin D? The sun. Calcidiol, when vitamin D is converted into calcidiol, the monocyte macrophages, which just are basically little cells that eat bad cells in the immune system, they act like it's just basically defending the body against antimicrobial invaders. So those macrophages, a macrophage is a cell that eats another cell, goes and finds those invaders. It's like Pac-Man. Vitamin D is like Pac-Man, basically. Goes and finds the bad ones and eats them up, and then you get points. Chronic illness. Chronic illness in general. Taking vitamin D can cut your risk of dying by more than half. And so I say that, not saying that your vitamin D is going to make you bulletproof, but taking vitamin D supplements in order to overcome a deficiency in vitamin D could cut your risk by more than half, as found in a recent analysis of more than 10,000 people. Not only was vitamin D deficiency associated with several cardiovascular related diseases, including hypertension, coronary artery disease, and a whole bunch of other cardio things that I could rattle off that are scientific terms, and diabetes, but it was also a strong independent predictor of all causes of death. Just that lack of vitamin D is not allowing the body to function the way that it could, and so we're more susceptible to other things. So researchers have found that patients with low levels of D were more likely to have diabetes, high blood pressure, and diseased heart muscle, and were 3 times more likely to die from any of those causes compared to with normal levels. So when it comes to heart disease, vitamin D is that cytokine is an anti-inflammatory. And so that inflammation in the arterial wall in the heart that's damaging that heart muscle is no longer there as much. It's not as potent, but also diet, just as we talked a couple weeks ago with Inflammation Nation, is another big part of that. And you can find that video online. Because we're not going to talk about that because that's a lot of information today too. But it also suppresses just vascular calcification just by maintaining those blood calcium levels. So when we have too much calcium in the blood and it's calcifying the arteries because of too much inflammation and everything, it's trying to harden the arteries and protect it, it's regulating that so it doesn't happen not on accident, but it doesn't happen. Okay? Let's see, there's a lot of information, but let's just talk about it. This is a big, long thing, so I'm just going to read it because I don't have it memorized. But more than 70% of study participants that were deficient in the vitamin D were based on a normal level of greater than 30 nanograms per milliliter of vitamin D. So that's just taking a blood test and finding the level of vitamin D in there and just seeing how potent it is in the blood, how much you have. And so we'll talk about optimal levels here in a little bit. But the latest research suggests that anything below 50 nanograms is actually a deficient state. So which means that all the people that were in the study, the 10,000 people that were deficient in vitamin D, there were more people that were deficient in vitamin D based on more current research. So they're saying that all those deficiencies, it actually helps more, if that makes sense. Okay? So, the number of vitamin D participants was actually higher, with more likely of a 90 to 95% of the patients in the study were deficient instead of over half. But it's quite extraordinary to see that some of their improvement with the lower levels had been reported. Because your body is designed to produce vitamin D from regular exposure to the sun, unless you live in a warm, sunny climate where frequency is more frequent. Yeah. There's a very high chance that we too, especially living in Iowa, are quite deficient in vitamin D. So that's the reason why we're talking about this. Chronic pain. In 2008, a study showed that more than 25% of chronic pain patients have low vitamin D levels, which could be because vitamin D controls a lot of that neuromuscular function. 2010 study showed that low levels of vitamin D had correlation with migraines and headaches. So low levels of D prevent blood vessels from constricting and dilating properly, and that's more because of that neuromuscular function, which can lead to a throbbing headache. Cancer. Vitamin D is able to enter cancer cells and trigger cell apoptosis, which is better known as cell death. Joe Ellen Welsh, at the State University of New York at Albany, injected vitamin D into breast cancer cells, finding that vitamin D worked as well as cancer drugs in doing that same thing. So when she did that, she injected a potent form of the vitamin D into the cells, and half of them shriveled up and died within days. The vitamin D worked as well at killing the cancer cells as the breast cancer drug, sorry, because I was reading it, tamoxifen. I don't even know how to say drug names because those are confusing. With any of those detrimental side effects, I think that it would be more important just to get some vitamin D.
It's tamoxifen.
Phonetically, it's tamoxifen. Good thing I don't do that stuff. Vitamin D regulates cells responsible and the genes responsible for cellular growth and survival. It helps shut down out of control growth to prevent malignancy. If malignancy prevention does not work, vitamin D will just kill the cell. So it just, if preventing that malignancy, it's like, okay, defense system number one didn't work, let's just kill it. And if a tumor actually develops, vitamin D will do what it can to cut off the blood supply to that tumor so it will not grow even larger. Vitamin D is awesome. Fertility. Didn't see this one coming. So, according to the European Journal of Endocrinology, given the high prevalence of infertility as well as vitamin D insufficiency in otherwise healthy young women and men, and the possible role of vitamin D in human reproduction, Research might lead to new therapeutic approaches such as vitamin D supplementation in the treatment of female and male reproductive disorders. Among women, vitamin D appears to impact in vitro fertilization, or IVF outcomes, endometriosis, polycystic ovary syndrome. And those are just some of the more common female endocrine problems, as well as boost levels of progesterone and estrogen, which help regulate menstrual cycles and improve the likelihood of successful conception. In men, vitamin D is very essential in the healthy development of the nucleus of the sperm cell and helps maintain semen quality and sperm count. Vitamin D also increases levels of testosterone, which is good for guys, especially as we get older and those levels decrease, which may also boost libido. And who doesn't want that? Women.
The wives.
Well, we'll see. Vitamin D in the flu. So vitamin D this year, just as flu season was rolling around, was a very hot topic, just with how it can help with the flu and help combat the flu. And it's even better than, just like the weird robot guy in the video said, that it's better than a flu vaccine. Vitamin D is highly effective against the flu, according to a recent study. Children taking low doses of vitamin D3 were shown to be 42% less likely to come down with the flu. So in this randomized double-blind study, 430 children aged 6 to 15 were followed between December 2008 and March 2009. Half were given 1,200 international units of vitamin D daily, while the other half just received a placebo, just sugar, water, or a pill. The influenza strains that were determined through the lab of testing them were determined by nose and throat swabs. And 18 of the children taking vitamin D contracted the flu, compared to 31 who were taking the placebo group out of that 430 kids. So over 42% less likely. Optimal levels of vitamin D. So as we were talking about, just those nanograms per milliliter, so just very small portions in the blood of how much vitamin D is in there. I mean, according to the research, it's a very wide range. You know, I was reading somewhere that normal vitamin D levels could technically be anywhere from 20 to 56 nanograms per milliliter, but that's just too broad of a range, so this kind of breaks it down a little bit more. So deficient is anything below 50. Optimal is 50 to 70. Treating cancer or heart disease is 70 to 100, and anything that you need more than that is a lot, basically. So this is just a fun little picture to give us an idea. But here's the blood levels. Effective blood levels, like I said, if you read anywhere, it could say anywhere from 20 to 56 nanograms per milliliter, but most optimal you would say 50 to 55. And there's blood tests that you can take to do that, but I mean, that's just, I think that's more important if we're going to do it orally, supplement taking vitamin D, just because you don't want to have too much vitamin D. You want to stay within your optimal ranges and levels, and I haven't done enough research on actually where you can get the blood tests and everything like that. You know, so we'll talk more about that when we talk about actual supplementation. So, just to prevent a heart, so we're talking optimal level right there is the 50 to 55. Just to prevent a heart attack, 24 to 36 nanograms per milliliter just to prevent a heart attack. 32 to 50 nanograms per milliliter just for breast cancer, for treating breast cancer, to help prevent breast cancer. 34 to 44 nanograms per milliliter for colon cancer. 34 to 38 for lymphoma. 34 to 52 for type 1 diabetes, and just prevention of type 1 diabetes. So, this 25 OHD right up there is 25 hydroxyvitamin D, which is just the blood level of vitamin D in the blood. Levels should never technically go below this 32 nanograms per milliliter. You know, but like we said, you can technically say that anything below optimal is a deficiency, so that's anything below 50. Anything below 20 nanograms per milliliter is considered a serious deficiency. Anything below 20 is what the currently what the recommended daily allowance according to the government is 20, and that just means you're just if rickets is right here, you're right there. And so they're just recommending enough just to make it so you don't get sick. Not enough to make it so you are healthy. And I have a really cool chart that kind of helps explain this, but I wasn't able to print it off because I couldn't find a computer copy. I only have one hard copy. And when I make copies of it, it looks really nasty. But I'll make copies for you guys. So, talking about just those optimal levels of that 50 to 55 nanograms in the United States, winter average is 15 to 18 nanograms per milliliter. I keep wanting to say deciliter. That's not helping me. Robert Haney, a medical doctor, said of all nutrients associated with chronic disease, none has the potential payoff like vitamin D. 90% of U.S. senior citizens are deficient, and 70% of the American public is deficient. Winter, when sun exposure is at its lowest, vitamin D levels can drop up to 50%. So if we're already not getting enough in the summer, if you're maintaining that 20, that just baseline, you're dropping a 10 when winter comes around, and you're not being healthy with that. And part of the problem is because of what we're told about sun exposure, and we'll talk about that in a second. So for supplementation, we can supplement with vitamin D3, which is cholecalciferol, and not D2, which is ergocalciferol. Most vitamin D fortified foods are vitamin D2, which is a synthetic form of vitamin D. It is not nearly as
effective?
Yeah, in the body. I was like, what's my word I'm looking for? It doesn't uptake as well in the body at all. And also when the body breaks it down into a toxic substance in the body. And I can't remember exactly what that was.
Huh.
D3 is 87% more potent in raising vitamin D levels in the blood than D2. Dietary vitamin D must be converted into active form in the body, and D3 is already that active form. Dietary D3 can be found in eggs, organ meats, animal fat, fish, and cod liver oil. So when we're talking about vitamin D, the thing about it is vitamin D has similar receptor sites as vitamin A. And so when the problem is sometimes people will hear something like this or read something and think, oh, holy cow, I gotta supplement my vitamin D, and they neglect vitamin A. And so vitamin D takes over all those receptor sites, and there's no vitamin A to kind of keep it in check. So that's how we can have that vitamin D toxicity. We can have too much of it, and it just takes over that cell. For vitamin A, we need an actual 2-to-1 ratio. And vitamin A isn't just, eating carrots and beta carotene, but there's other ways to get vitamin A. But the worst way to get vitamin A, I think, is to eat liver, which is very high in vitamin A. But we can talk about vitamin A another time. Yeah, but like I said, for excess vitamin D, vitamin A protects us from that toxicity. You cannot get too much vitamin D from sun exposure, but we can get it too much from our dietary exposure. We're not designed to receive vitamin D from food, but we are from sun. That's why it works so well. Well, here's some facts about vitamin D3. It is converted 500% faster in the body than vitamin D2. That's what I was going for with that one. D3, like I said, is 87% more potent. It produces a 3-fold increase in vitamin D storage over D2. So if our body's going to store up vitamin D just when we have that exposure from the sun, D3 stores it up faster. So luckily we don't get D2 from the sun, we only get D3. D2 has a shorter shelf life, which I think is weird that they put that in foods, especially foods that are non-perishable, cereal, when they fortified that stuff for kids. D2 is synthetic and used for most vitamin D prescriptions as well. So if you go to your medical doctor and ask for a vitamin D prescription, you're more than likely going to get D2. Because it's cheaper. Because it's synthetic. Best way to get vitamin D. The sun. 90% of the vitamin D produced in the body is a result of exposure to sunlight. The best way to do it is to expose large amounts of the body, of your skin, to the sun for greater than a few minutes, ideally up to 20 minutes, but ideally also 40% of your body to the sun. Sun exposure should be as close to noon as possible, ideally between 10 o'clock and 2 o'clock in the day. Like I said, Caucasian skin, most of us in this room, in Iowa, only takes about 20 minutes of exposure to reach that equilibrium of what the body needs, because after a certain amount of time, the body takes up exactly all it needs and will not produce that vitamin D anymore.
Is it 20 minutes a day, a couple days a week?
I would say a day, because you can't overdo this. But the bummer about living in Iowa is that our peak time for vitamin D is between March and September. Because we have certain, am I talking about this in a second? Yes, I am. Awesome.
Okay, sorry.
No, I couldn't remember. So, how do I want to say this? Well, we'll talk about it right here. So we have different wavelengths that come from the sun. There's over 1,500 wavelengths that come from the sun. And UVB wavelengths are the only one that produce vitamin D. The biggest concern most of the time is UVA, because those are longer wavelengths. So UVB is a shorter wavelength, so it doesn't travel as far. It's not as strong, it's not as potent. UVB is a more stronger, more potent wavelength, and that's the one that we should be concerned about when it comes to cancers and aging of the skin and everything, because it penetrates harder. So UVB, that's why living where we live, our most potent time to get that vitamin D before the body can use it is between 10 and 2, because you want the sun to be at an angle of the earth. I mean, I can talk about it geometrically, but I'm not good at it. But it has to be greater than 50 degrees. So when it's coming around, here's 50 degrees, 10 o'clock, 2 o'clock, and then we're going back down. So that's when the UVB can enter the atmosphere the easiest, because it doesn't have to travel as far. Anything before that and anything after that, you're getting more UVA rays, which are
They're more
bad rays.
detrimental.
Yeah, they're more detrimental because they fry you a little bit. So that's why we can't get that good sunlight through windows, can't get that good UVB through clouds, because it's not strong enough to penetrate clouds. So when we're getting sun, because when you say, oh, you can still get sunburn even though it's cloudy out, yeah, because you're getting sunburned by the bad stuff. Well, that's also why technically, do I want to jump in this? Yeah. Technically, most sunscreens that are produced these days are not good for us, because they block out those UVB rays because they're not strong enough to get through. So our best way to combat that is through our diet and antioxidants, which will protect us from the sun, but also being smart when you're in the sun. Don't go out there for 4 hours and then be like, hey, I'm red, awesome. So that optimal time is 20 to 30 minutes, but you can also build up a tolerance to it. So right now, as spring's swinging in, summer practically, you go out and you just build up a tolerance that time, so you're out there for 20 minutes. And the body adapts to that, the body tans a little bit, the body gets a little bit of color, so it's increasing those melanocytes and the melanin in the body, so it can protect you from the bad rays. Because when you're getting the good rays, you can take that all day long, the body's going to do what it's supposed to do with it, and then whatever. But it's the bad UVA rays that your body's producing its own sunscreen by doing that. But also too, your clothing itself has an SPF of 15. So just once you realize, okay, I'm cooked a little bit, throw a shirt on, you're good to go. Throw a hat on, everything. But a good natural sunscreen that's also just going to be good for your skin because of the omega properties in it is going to be coconut oil. So you use organic coconut oil, and you can just rub that onto the skin, and that's a natural way to help with that sun, but also a natural way to help absorb the stuff and keep it healthy. Because that skin burns as it dries out. So we need to stay well and hydrated, but we also need to moisturize it, and that coconut oil will be good for it too. I really could have jumped into what to look for in a sunscreen. I wanted to kind of stick with this kind of stuff, but I can find that information for you guys, and maybe next time we can talk about sunscreen. Because there's certain things in the sunscreen too, if we're going to buy a sunscreen, that you want to absolutely avoid, because it's just chemical trash that you're rubbing onto your skin. And for a while there, because I quit paying attention to people saying it, but I remember when I was in college and everything, everybody was like, well, if you're going to step out in the sun, you better put sunscreen on your face. Every day. Doesn't matter if you're going to be out there, you just better get it because the sun is bad. How natural is that? It's the sun. How natural is our body? Our body's designed to interact with the sun. You know, so we get this increase of skin cancer, especially around Iowa and where we are now, because everybody's sheltered for the winter, and the sun peaks out in times like this, and they're like, well, heck yeah, and they soak it up all on the first day. You know, and then sometime through the winter we'll go to Florida for a week, and then we'll soak it up all in a week. You know, so we're trying to get our sun exposure too much at one time instead of just gradually doing it throughout the year. I might get condemned for this, but another good way to get our UVB rays is a tanning bed, especially in the winter.
Yay! I'm glad you said that.
But there's certain things we got to look for. So we can call
Organic.
yes,
tanning beds.
organic tanning beds, better known as sunlight. But in the winter, so it's not going to tan for 20 minutes and laying in a bed. So you want to call it. I was meaning to call ahead today, but didn't have a chance. But you want to call ahead to your place that you're going to go to, or find a place based on what kind of lights that they use. So what you want to have is electric ballasts, not magnetic, an increased percentage of UVB rays in the bulbs, you know, so they can still have some UVA, but you want more UVB than UVA. So the nice thing about tanning is the fact that they can put out more than the other, whereas the sun just throws whatever it's got, you know. And you want low pressure bulbs. And so you hop in a tanning bed, and, you know, not for 20 minutes, but just enough to get that exposure. And so obviously a tanning bed's higher concentration. So I was talking to somebody about this. They're like, so you just go to the tanning bed just like you would out in the sun? Like, can you imagine laying in a tanning bed for an hour?
No.
Please don't. You know, so it's just, it's a higher concentration of the sun that you're getting, so you're good for 5 to 10 minutes. You don't need much more than that, maybe once a week. You know, and especially in the winter. So I mean, this is a lot of times how some people that I know do things, is that in the winter they'll go tan for 5 to 10 minutes, one day a week, and then the other days of the week they'll orally supplement with a vitamin D, with a good vitamin D3 supplement, and that way you just keep your levels up. And so when we're talking, I mentioned this, when we're talking about oral supplementation of vitamin D, what you want is, depending on the research too, 36 international units per pound of body weight. You know, so if, I'm not going to do the math in my head, but, and I also read too, that any adult just needs 8,000 units, period, a day. 8,000. Anywhere from 5 to 8,000 international units of vitamin D3 a day. So you actually use the calculation for checking it for kids. You know, so if you have a little kid, you know, anywhere from 12 and under, you can do the body weight calculation. You know, so I have a 3.5-year-old, and he takes, I don't know, what's 36 times 30? He takes almost 1,000. If I'm good at math, that's somewhere around there. You know, so we've got our vitamin D drops that we have is one drop is 500 international units, and he takes, you know, just to be on the high end, he takes maybe three drops a day. And that just helps with everything that we're talking about. You know, helps him avoid getting the flu, helps him avoid stuff like that, but just keeps him healthy. I'm not saying things like, oh, let's avoid this, let's avoid that, but let's just keep our body as healthy as we can all the time. So it's
How do you know it's being absorbed though?
with the D3?
It just automatically will absorb, like a lot of times they say if you take fish oil, you just, a lot of times which is, it'll go right through you. It doesn't even absorb, so.
Because your body will take what it's supposed to take and then get rid of the other stuff.
Okay.
You know, so vitamin D is an oil-soluble, a fat-soluble vitamin. And so when we eat our good omegas and our good fats, it kind of helps balance things out as well. You know, whereas vitamin C, it's a water-soluble vitamin. You can take that until you're blue in the face, and whatever your body doesn't take, it's just going to excavate.
Is liquid vitamin D better than a multimodal vitamin then, or?
Yes. Yeah, you want liquid vitamin D, a specific liquid vitamin D, because a multivitamin, a lot of the multivitamins that are out there, especially if you're going to get it from Walgreens or something, is not a quality vitamin to begin with, so more than likely they're going to have the D2 in it. You know, so
Short
you can,
on D,
Yep.
won't have this idea.
You
D3.
Yeah, and so you want D3 because D3 is the better form of the vitamin, and D2 is the lousy one. You know, but also too, you can get it just like I said through our food sources, through fish and through whatever. What was I gonna say? Yeah, eggs,
Liver.
liver, organs,
No, I don't think you
through
can
the
get it through
giblet
liver.
gravy. Eggs, animal fat, cod liver, and fish. You know, so if you have that steak that's all nice and marbleized, it might be a good one. Because those guys are getting vitamin D too. I mean D as well, not D2.
D also.
D also. Whoops. You know, so just the biggest thing is just the when we're getting it naturally, just through the sun, is just watching the wavelength that we get. You know, obviously we can't see it, but that's why we just optimize our time to make sure we're getting that UVB, not UVA. So don't go crazy with it, but get some good exposure. Just kind of wrap it up just with a little bit just about the omega-3s, like we were saying, because it's a fat-soluble vitamin. We want to make sure that we're good with our omegas. You know, so Dr. Hassel was talking about our optimal ratio of omega-6 and omega-3s is to keep it as close to 2 to 1 as possible. You know, so omega-3s cut down, omega-3 fats cut down on the risk of skin cancer, and bad omega-6 fats will stimulate the development and progression of human cancers. Omega-3, like I said, will inhibit it. So that's just a little bit more about the diet and how to balance it, and it's just good for the skin. You know, so that's just a little bit about vitamin D. And more questions the merrier. Yeah.
I don't know if you said this or not, but when wintertime comes, everybody gets depressed and grumpy.
Yeah. So I mean, vitamin D is just good at.
And so,
because it.
not having enough vitamin D, I guess what I'm asking is, if you're deficient on vitamin D, does that affect your mood?
So vitamin D is so serotonin is just one of the chemicals that's released when we're in the sun and everything. And that's so our seasonal. What our depression in the winter is they of course have given it a name because they got to give everything a name. So seasonal affective disorder, or SAD, how appropriate, is a lack of serotonin in the body. And so that's lacking because there's not enough sunlight, which is lacking because we don't have enough vitamin D, because vitamin D is helping be responsible in the release of that hormone of serotonin. Because vitamin D is a pro-hormone that is going to affect that.
And so the lack of serotonin,
Could be a lack of vitamin D as well.
but the serotonin is what makes you feel good?
Yeah. Makes you feel happy. Without the sunlight. Or with
And it
the
doesn't
sunlight.
take much sun to make everybody happy.
No, not at all. No, even if it's 32 below zero and it's raining down sun, everybody's like, it looks gorgeous out there. Don't step out there. It makes everybody happy just to see it,
Yeah.
especially here in Iowa.
Yeah.
That's how it goes. That was a good question.
That's a good answer.
I do it.
So if you're taking a vitamin D supplement, you should be taking something else to get the vitamin A, right? To make sure that you have,
We should balance it with the vitamin
balance
A.
it
You know,
with
so
vitamin A.
if you want to, you can supplement a good vitamin A supplement with it. You know, so the jury's still kind of out on the best way to do it. I've heard anywhere from you almost do like you kind of amp up the vitamin. It's tough. You kind of amp up the vitamin D a little bit. Like if you can almost go a week on, a week off. You know, so you do a week of vitamin D, a week of vitamin A, a week of vitamin D, a week of vitamin A. You know, it's confusing. Or you can do both at the same time, but it's tough because they both kind of battle for those receptor sites. So that's why it's
So they fight on the way through.
yeah. So I mean, it's just kind of the jury's still kind of out on that one.
How much vitamin A should you take then? What, as far as,
Not 100% sure, but I'll find out.
okay.
Yeah. Just because I was curious about that myself, but I couldn't find it. But I'll find out. I'll dig a little deeper. I got distracted by the vitamin D.
Most vitamins, multiple vitamins, they have like 10,000 IU or ED or whatever you call
Yeah.
it, of vitamin A. So
I'll find
then
out.
vitamin D is normally 400 and vitamin E is 400.
But the vitamin D that's in there is not enough because it's 400, and like I said before, it's usually the D2,
Vitamin D2.
which isn't the one that you want anyway. You know, so even just, it depends on the supplement that you're getting, you wanna watch the kind of supplement that you're getting, because a lot of supplements are lousy and
Yeah.
aren't very well absorbed in the body anyway. You know,
So why doesn't the medical community recognize that they should check your vitamin D when they check your cholesterol and all of that business?
that's a brilliant question. So that's the other thing also
They just-
that you just mentioned, cholesterol too. That's not one thing that we need to be scared of, because vitamin D needs cholesterol in order to exist. Because it is a hormone, and cholesterol is actually a hormone as well. The fact that it is created
So it could
by
reduce your
the
cholesterol.
encounter. No, it couldn't reduce it, but it needs it.
Oh, okay.
You know, so high cholesterol is not necessarily a bad thing, and we could jump into that a little bit right now, but Dr. Hassel definitely jumped into it a couple weeks ago when he was talking about just inflammation and fats and everything. So I really suggest going to our website and finding that video, because he explains it a lot better than I would. So it's called Inflammation Nation, and he talks a lot about just omegas and cholesterol and HDL and LDL. And I could try and paraphrase it as much as I could, but I know I'm gonna get something wrong, then I'm in trouble. Not with him, just in general. That was a good question. But I wish I knew, But I think that I've heard, because of just more of the talk about vitamin D, is that they're wanting to check blood levels more often, but they don't do it just routinely. It's just if, okay, somebody presents with this, maybe they're vitamin D deficient. You know, but I wish I could explain why the medical community doesn't do a lot of things.
Yeah.
That's why.
But your dad's oncologist, he checks
His
his
D
vitamin D level every time he sees him now.
Yeah,
So,
it's because he knew he was deficient,
right.
and he needs to get more.
But, and he wants to make sure that it stays up. But the levels where he wants you are still lower than, are they?
It's been 30 at least.
So that's, like I said before, it's just
Yeah,
kind of,
it's-
it depends on the research that you read.
Mm-hmm.
So that 30, depending on what he was reading, could be just the minimum. So he wants them on 30 at least, so he's just looking at, okay, what's the minimum that he can get by with? 30 sounds good. 30 sounds good, but 30 is the minimum. But when we're talking about this, or optimal, because optimal is more than minimum, is gonna be higher than that. So it depends on who you ask. You can be deficient if you're below 50, or you can be deficient if you're at 30. So, it could be, like I was saying, with that range, anywhere that they can say that range could be anywhere from 20 to 55, but it just depends on, that's just too broad of a spectrum. We gotta narrow it a little bit just so we know, okay, this is good. Otherwise, it's like, okay, anywhere from 0 to 100, you're all right. It just gives, it's too much room for, too much of a margin of error.
So what should the blood level be again?
Optimally, 50 to 55 nanograms per milliliter. So the blood test is 25 hydroxy vitamin D. That is the best way to check it. So maybe the reason he was saying anywhere in the 30s is because a lot of the cancers that you're looking at in helping with is in those 30s right there. It's still a large range, like that breast cancer is 32 to 50. So everything's going upward towards that 50, so you might as well just kind of hang out at 50. 'Cause it doesn't hurt. Any more questions? Yes.
One more, because Dr. Vince talked about eating grass-fed beef and the animal fat and the importance of that too, so.
Because you're just getting the good fats in that as well, but also, because vitamin D is a fat-soluble vitamin, it's going to be stored, a lot of it, the excess of it will be stored in the fat. And so that's why when you eat the animal fats, you're going to get the vitamin D, so that's your natural way to get it dietarily. So that's why a good marbled grass-fed steak is going to be yummy.
How do you
Keep
know
going.
if your steak, or if your cattle you're eating were grass-fed or grain-fed?
Most stuff in the grocery stores are grain fed. So right now in Iowa, most stuff that you're gonna get that's grass fed, you have to, almost,
You have to go to the farmer?
yeah. Either, a lot of farms are starting to like kind of do a co-op thing where you can buy a cow and they'll deliver it, or not even buy a cow, you can do like a,
You can do half or a quarter.
yeah, or you can even, a lot of them just have an a la carte menu that you can order from them and they'll deliver. They
Oh.
usually have a minimum that you have to get like 20 pounds for $200 or something like that, or 20 pounds for $100 or whatever. They'll deliver it after you order it. So you can either do like a full, there's an array of options. I know, I think we just got some information actually the other day about a farm that Dr. Hassel was talking to me about, and so just to give out information to everybody else, because he was curious about that too. Because it is really hard. I know Trader Joe's does have, I think, some grass-fed options. I haven't gotten them from there yet, because I haven't needed to yet. But I think they're a little more expensive just because you're getting it from a store. But getting it from the farmer themselves, I think it'll cut down. But yeah, that's the best way to get it right now. So until our demand for it increases, then the stores won't do it. It's just like organic milk when it was starting to come out. It was scarce and sparse to get it, and then more people were wanting it, and more people were buying it, and then now you find it everywhere, which I still don't recommend.
You don't recommend? Or do?
That's an entire.
What did you say?
Well, the organic milk, I said I don't recommend.
Oh,
Organic, yes, but milk, we'll talk about that one on a different Tuesday. Good question. Because a
So
lot of
milk's
people
not
know
good to
that.
get vitamin D from,
No,
right?
because it's,
Like they say, but they say,
Yes.
right?
no, it's probably one of the worst ways. Sun is the best, 90% better than your diet.
doesn't milk already have vitamin D in it because it naturally comes from the cow?
Well, but the thing
But they
about just getting it
pasteurize
dietary, the pasteurization
Oh, kills it, doesn't it?
basically kills everything.
Oh, yeah.
So you're drinking white water
And then they put it all back in again and.
in fortified ways.
So pasteurization isn't a good thing, really.
Not technically, no. Not at all. It increases shelf life and it just makes it so all the bad bugs that everybody's afraid of that's destined to kill us die. But a lot of those bad bugs are good for you. But also too, just the thing about getting it dietarily, through milk and everything, that you can only expect about 200 to 400 international unit uptake of vitamin D through your diet. So no matter how much you take just through the food, because of all the conversion and everything it has to do, because it's not the best way to get it, you're only going to get so much. So supplementing is a little better way to get it, but it's just risky because you can overdo it a little bit. But I'm not worried about that because it's tough to overdo it when we're already all deficient. So you got to take a lot of it all at once. So living here, supplementation is not as worrisome for me than the fact that you're going to be vitamin D toxic because we're already too deficient in it. But just going back to the statement of the fact that our best way to get it is sunlight. It's the way that the body knows how, and the way the body was designed to take in vitamin D and create vitamin D is to be exposed to sunlight.
And you were saying to protect, oh, I'm sorry, go ahead.
No, I'm sorry, go ahead.
Rock, paper, scissors.
Okay, I'll go so I don't forget.
Yeah.
Got it ready.
No, you were saying the best way to protect your skin is
Is clothing.
organic coconut oil?
Clothing, organic coconut oil. There's other oils that I forgot. I just know that organic coconut oil is the one that I've heard most about.
Tamanu or some is another natural.
Sure.
So we have to look for organic on the bottle.
Yeah, you can go to Hy-Vee and just the Health Mart and honestly get the cooking coconut oil that they use.
Oh,
And when you're not using it, you can just put it on your arms.
oh, good idea.
It's just because it's not like an oil because coconut oil is solid. It's a saturated fat. It's not an oil like you're not spritzing olive oil on. Yeah, or vegetable oil. And a little bit when it comes to to the coconut oil goes a way long way. You know, I mean, you don't need a whole lot to get everything going. You know, and just as you see, because it'll be soft and it'll be, I mean, your skin will, you'll know that it's on, and as that you can tell that it's absorbing and drying up with the sun, then you know it's time to reapply.
Okay.
I think I
Plus,
was-
coconut oil does so many other good things for you. It's good for your heart, it's good for your brain, it's good for your other organs, it's
Yeah, I've been learning that.
amazing, yeah.
And as I was reading other stuff, I didn't write it down, so I'm just gonna try and remember what I read. Just the increase of skin cancer ever since everybody was all about sunscreen and doing way too much sunscreen.
It's really increased, I'm assuming.
So I think a lot of it is because it is blocking the good UVB rays that are good for you to actually increase vitamin D, which will help you fight skin cancer, ironically enough. But also too because, now I'm just like Brad and I lost my train of thought.
Get on the bus.
Because just the junk that they use to create it, that you're putting in your skin and your body's absorbing. You know, it's just, I mean, banana boat wasn't around when our ancestors were forging the Oregon Trail. You know, and Lewis and Clark didn't die of skin cancer. Yeah. You know, it's just that good exposure, and there's other stuff that we were reading too, that we have a higher prevalence of skin cancer here in where we live, as opposed to people actually on the equator. You know, and they live in
Wow.
the sun. But they're doing it right, and they're in it all year round, so their body's adapted to it. And so we're just in such a flux and wave because we see it for 4 months and then we don't see it. And then we see it for 4 months and we don't see it. So that's just where our big problem is, because the second that it pops out, like I was saying, that you're like, oh, sunmeat.
Mm-hmm.
You know, so it's just that overdoing, you know, it's just like, you know, whoever's gonna fast from, I mean, it's Lent right now, and it's almost Easter, and everybody's saying, oh, I'm not gonna have chocolate over Lent. You know, and I guarantee when Monday rolls around, they're gonna get their big old candy bar. You know, but it's just that same situation, because then they eat all that and they feel lousy.
I get
You know, so it's just
fasting
the same
for
thing. Yeah.
I'll give her a watermelon.
You know, so it's just, wait, not enough, and we don't get it, and then the second that we can, we take it in too much.
overindulge.
Yeah. You know, so it's just being smart with the sun. So yes, it's true, don't burn. Try not to burn. Do what you can not to burn. But if you burn, the best way to heal it is raw aloe from a plant.
So break it off and
Break it
rub
off
the
and
juice on
slather
it.
it on. We've got an aloe plant at our house above our fridge that my wife just saw a picture of it, and she's like, oh wow, when we first bought it, it was like that big, and right now it's like this big.
Oh, really?
Yeah, and those things never die.
Oh.
And it's the best way to help heal that skin.
Hmm.
You know, so yes, we're gonna get sunburn here and there. You know, but it's not gonna kill you. I mean, obviously, don't get sunburn all the time. Don't be like, hey, this red's gonna turn into a sweet tan in a little bit. You know, so it's just that starting with that little bit of exposure and adapting as your body adapts with that exposure right there. You know, so you can start with the 20 minutes and you realize, okay, my skin got a little pink, I'm feeling a little warm, let's put a t-shirt on, all right? And then next week that you're out, or the next day, you're like, okay, I went 30 minutes before I started to feel that way. You know, you just gotta be observant with what's going on. That's the best way to do it. Make sense?
Sure.